I'm Dr. Ahmed Shakir. I'm a neurology consultant at Sheikh Shafdut Medical City. And with me today is Dr. Radwan. She is a nutritionist who has experience not only with pediatrics, that's her field of expertise, she's also interested in education, public awareness, as well as research and educating people about latest research in regards to nutrition. Today I have Dr. Yara with me. She's going to talk to us a little bit about multiple sclerosis and diet. And is there such a thing as an ideal diet for people with MS?
Thank you, Dr. Shatila, for the introduction. The answer is no. There is no specific diet for multiple sclerosis. Of course, a healthy diet can really help patients with multiple sclerosis to maybe minimize or maybe delay the symptoms, but in general, there is no specific diet. We say that we always recommend patients to always follow a healthy diet in general, so a diet that is rich in fruits and vegetables, because they have a lot of nutrients, as you know, and antioxidants. So we want to minimize the inflammation in the body, and fruits and vegetables can play a big role in doing that. Also, we need to minimize fat, especially saturated fat, and of course trans fat. So any food that is processed can maybe have trans fat in it, so we need to minimize that as much as possible. And we need to rely on healthy sources of fat, such as fish, olive oil, nuts, seeds, avocados, for example. So all these sources can provide healthy sources of fat. Okay. Also, we need to include fiber in our diet, so things like whole grain instead of the processed carbohydrate. Also like legumes, for example, nuts and seeds, and all kinds of plant-based food can provide a lot of fiber. So I would say overall, it's the Mediterranean diet, or following the rules of the Mediterranean diet, can really help patients with multiple sclerosis. And on top of that, we need to make sure that the weight is healthy, because also extra weight or overweight can really be problematic for patients with multiple sclerosis.
Got it. Thank you very much.
Thank you.
So when we think about vitamins and supplements, you know, we're always bombarded on TV and just when we go to the mall, yes, about all these new vitamins and supplements. And this is mixed in a special way, so you absorb it in a special way.
Yeah.
What does the average layperson get from all this information? Should we be taking all these vitamins, or is there a need for them? And especially if you have MS or a chronic disease,
yeah,
what do you tell people?
Yeah, that's a very good question, because like you said, we are bombarded and it can be very confusing for people. So in general, as a nutritionist, we always recommend people to get their nutrients from food. However, for people who might have some kind of deficiencies in certain vitamins or minerals, of course, they need to compensate that by taking supplements. But we always recommend that patients should consult their doctor and their nutritionist or dietitian first, and maybe have some blood tests done to make sure that their levels are low, and then we can supplement. Don't do that just randomly, just decide to take a supplement by yourself. However, for patients with MS, it's a good idea to take a vitamin D supplement, as it is with other people as well, because in general, our vitamin D might not be sufficient, and there might be a link between MS and the deficiency of vitamin D. So it is a good idea to supplement with that. A multivitamin can also be a good idea. We should be careful not to take high doses from certain vitamins, because certain vitamins or minerals can cause toxicity if taken in big amounts. So in general, let's take our nutrients from a healthy, balanced diet. Let's consult our doctor if we have any concern, and the vitamin D supplement and maybe a multivitamin is also a good idea.
Very good. Thank you very much. And if people have any questions or would like to reach out to you, how would they be able to get a hold of you?
Yes, so I am available on social media. My page is called The Magic Meal, on Instagram, on Facebook. So they can reach out, they can send me a direct message, and I'm very happy to answer them. Can I also mention one thing? We need to mention the importance of gut health when it comes to MS as well. Yes. So there's a lot of research in this area, and maybe some promising research for the future. However, for now we say try to make sure that you're taking prebiotics and probiotics at the same time. So the probiotics are the good bacteria that can really have beneficial effects, such as, for example, taking them from kefir or yogurt or fermented food. The prebiotics are the food for the bacteria, so they come from fruits and vegetables such as onions, such as garlic, such as leek, asparagus, those kinds of fruits and vegetables. They can be also very beneficial for our gut bacteria, and this can play a role in minimizing the inflammation in our body.
Thank you very much.
Thank you.
It's always a pleasure talking to you, and thank you very much for coming today.
Thank you so much for inviting me. It's a pleasure to be with you.
Much appreciated.
Thank you.
Thank you.